All right, welcome back. Health officials are warning about a parasitic infection that is spreading quickly across the country. 18 states now seeing cases of cyclosporiasis, a potentially dangerous stomach bug that can be traced to produce and water. And there are more than 40 confirmed cases in Maryland and Virginia. That number growing. So joining us now to talk about this is Kelsey Holloman with the Virginia Department of Health. Kelsey, thank you for taking the time to be with us.
Happy to be here. Thank you.
Yeah, and first just talk about for us how fast this appears to be spreading and what you're seeing in Virginia.
Yes, so currently Virginia has reported 10 cases of cyclosporiasis. We typically tend to see cases of cyclosporiasis increase during the spring and summer months and into the early fall months. So as cases are continuing to increase, cyclosporiasis is getting out more and into the news. But here at the Virginia Department of Health, we are continuing to monitor those reports that are continuing to come in for cyclosporiasis.
And we said produce and water. How do we believe this is being spread right now?
So mostly right now, typically cyclosporiasis is not spread directly from person to person. Infected people do pass the cyclospora parasite in their feces, but that particular form of the parasite cannot make people sick. The parasite needs time in the environment to change into a form that can make people sick. And so that form of the parasite can then infect someone by entering the body through the mouth, typically by eating or drinking something that is contaminated with cyclospora. Typically this time of the year, we tend to see cases primarily that are associated with international travel, primarily to tropical areas, and then any domestically acquired cases of cyclosporiasis typically can sometimes be linked back to imported fresh produce items.
Okay, and I hate to get too deep into this, Kelsey, but is this just, an upset stomach for a week, or are these symptoms usually severe enough to put you in the hospital?
So we don't typically see a lot of hospitalizations due to cyclosporiasis, but cyclosporiasis can cause severe watery diarrhea. And it can also cause other symptoms like loss of appetite, weight loss, bloating, increased gas, stomach cramps, nausea, vomiting, muscle aches, low-grade fever, and fatigue. And then typically that watery diarrhea, especially for a prolonged time, can lead to dehydration. So that is typically the most kind of severe symptom or outcome we typically see from cyclosporiasis infections.
And that would be the time then, if you reach that point, that possibly you would need to go see a doctor if you are dehydrated severely. Best ways, Kelsey, that people can protect themselves from getting this just unpleasant, very unpleasant parasite.
Yeah, so to prevent cyclosporiasis, you want to wash all of your fruits and vegetables thoroughly under running water before eating, cutting, or cooking. You also always want to wash your hands carefully with soap and water before and after food preparation and after using the bathroom or changing diapers. And then people who are traveling, especially to tropical areas, should try to avoid eating raw or undercooked foods or drinking untreated water while they're traveling.
Really good advice just to keep everyone safe from this right now. Kelsey Holloman with the Virginia Department of Health. Thank you so much for joining us with the update and those reminders. All right, take care and stay with us. We'll be right back.